Mr. President.
Senator from Louisiana.
Mr. President, thanks for recognizing me. Mr. President, before us as a Senate right now, aside from the issues that Mr. Blumenthal referred to, is the repeal and replace of the Affordable Care Act. I'm a physician. I've been practicing in hospitals for the uninsured for the last 25 years. And I would like to, in one sense, say that gives me special standing to speak about this issue, but in reality it does not. Senator Moran from Kansas spoke up the other day in our lunch, and he said that health care is like no other issue. And he spoke of a friend of his approaching him at church with tears rolling down her face. Her mother had a pre-existing condition, and she was so concerned that we get this right. I don't need to say I have special standing as being a physician. We all have special standing from living, having families and friends who, sooner or later, health care will affect profoundly. Now, the Affordable Care Act, for many, is not working. Premiums are going sky high. 3 days ago, I had a communication with someone in San Francisco. Her young family has $20,000 a year premiums, $6,000 deductible for each member of the family. In San Francisco, already paying so much for housing, food, transportation, $20,000 on top of that for a family of relatively modest income. Then I spoke to someone in Washington, D.C. His family's premium is $24,000. They have a $13,000 deductible. He said, I am out $37,000 before my insurance kicks in. I reassured him that his colonoscopy would be for free. I don't think he thought that funny. And then there's a friend of mine who last year in Louisiana, his quote, for the policies for he and his wife, 60 and 61, was $39,000 for 1 year. $39,000 for 1 year with a deductible. Now, we're being told that there will be premium increases this coming year. In Connecticut, they've just announced they're going to be 15 to 35% higher. In my own state, I've been told they may approach 30 to 40% higher, although that's not definite. The reality is that the premiums have become unaffordable. President Trump campaigned upon this. He had 4 things he told the American people. He said he wanted to cover all, caring for those with pre-existing condition, eliminating the Affordable Care Act mandates that people hate so much, and lowering premiums. And I'd like to say I think it's part of President Trump's kind of intuitive genius. Whatever you say about the fellow, he certainly has an intuition about sometimes how things work. And of course, the way you would lower premiums is that you would cover all, and by covering all, you expand the risk pool, which then lowers premiums for those with pre-existing conditions, but keeps them lower for the rest of us. Folks ask how you can do that without mandates, and I say you can do it through the mechanism of the Cassidy plan of the Patient Freedom Act, which is to say you have an auto-enrollment feature. Now, by the way, here is President Trump. He's said it many times, but here he is in the Washington Post, 1/15/17, just before he takes the oath of office. We're going to have insurance for everybody, Trump said. There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with us. You cannot have a stronger statement from a fellow who is about to rise to be inaugurated and give a speech in which he spoke passionately of the forgotten man and the forgotten woman. President Trump pledged to remember them. Well, the question is, how do you lower premiums? How do you fulfill President Trump's goals? There are several ways to lower premiums. I just described one where you fulfill the other parts of his contract with the voter, which is you cover all. And by doing so, you increase the size of the risk pool, and therefore you lower premiums. There's another mechanism. You can put in price transparency, do other things to lower the cost of medical care, which in turn lowers the cost of health care premiums. But there is one way which is not so good. One way that you can lower cost is have a crummy policy, which hardly covers anything. And you think you're getting a deal on the front end because premiums are low, and then you or someone in your family gets sick, and it's not such a great deal after all. I was asked about this on a Sunday morning show, and just spontaneously came up with something called the Kimmel Test. Jimmy Kimmel, a late-night comedian, spoke of his son being born, and we can all imagine, this happens 2 weeks ago, his child is born. I suspect somebody is videoing it. It is going to be a moment of celebration. And as the child emerges and everybody wants to lean forward and hand the child to the mother and the father to hold and cuddle, instead the doctor and the nurse notices that the child is blue. Blue meaning he is not getting enough oxygen. It is quickly realized that something is profoundly wrong. And instead of mother and father hugging and bonding with the child, they are pushed to the side. They hear a code blue called, which means that this child will die if something is not done immediately. I was not there, but I've been in similar situations. And they're being asked to sign forms that would allow this child, their child, whom they've not yet held, to be transported by helicopter across Los Angeles to have emergency surgery that day, and being told if they do not sign this form, that child will die. Now, Jimmy Kimmel pointed out, he's a millionaire. He could afford it. But he also points out, others not so much. And so I think that brings us back to what President Trump said. President Trump, who said, I know the last one, who said, we're going to have insurance for everybody. There was a philosophy that if you can't pay for it, you don't get it. That's not going to happen with us. So the Jimmy Kimmel Test, if I can put this back up, is that we're going to protect those with pre-existing conditions. But we will do it by lowering premiums and not by giving crummy coverage, but rather by having adequate coverage. And so if our approach passes the Kimmel Test, then we feel like it is a way to go. Now, how do we go from here? We can recognize premiums are too high for middle-class families. They can no longer afford it, and that is before the premium increases which are about to occur. But I will also say that the way the Affordable Care Act was passed, and not blaming or praising anyone, that only one party was engaged is not the path forward. History says that any time there is significant social legislation that has an enduring effect in the United States, both parties engage. I want this to change. I would challenge my Democratic colleagues to become engaged. Mr. President, some have said, oh my gosh, Republicans are doing this through reconciliation. Isn't that terrible? I would say it presents opportunity. We don't need 12 Democrats. We don't need 8 Democrats. We can have 3 Democrats, 4 Democrats. Anyone who cares enough about the people in their state and their premiums rising 20 to 40% per year, that they will put aside all the pressure from a political base and say that the people of my state are more important than the political pressure I may feel. And they will step forward to influence the final product. We know that if folks come in from the other side of the aisle, we will have a different product than if it is only among Republicans. Just as if Republicans had participated in the passage of the Affordable Care Act, we would have had something perhaps a little different than the Affordable Care Act. Now, I am not pointing fingers. I am just observing that it would only take 3 or 4 Democrats to break ranks, to step across the aisle, to ask for what they would need. This is not kind of you come to us and you don't get it. No. We have a meeting of the minds so that we can come to the policy that fulfills President Trump's pledge. His pledge to cover all, caring for those with pre-existing condition, eliminating mandates, and lowering premiums. Mr. President, I just conclude. We have an incredible opportunity before us to bring relief to those middle-class couples struggling with premiums which they can no longer afford and deductibles which they will never meet. And if they don't meet and afford, if they do not purchase the insurance, being fined, and the accumulating resentment to Washington because they're stuck with this. And we can address that issue and at the same time fulfill President Trump's pledge that all will have coverage. Some said that you can't get it if you can't pay, but that's not going to be the case with us. But provide them that coverage with something which passes the Kimmel Test. Mr. President, I look forward to working with our Senate to come to this solution. I yield back.